Hey, this is Mrs. Reichelt, and this next video is going to go ahead and go into the different organs of the respiratory system. So we're not going to talk specifically about the physiology yet. We're just going to get into the organs. So the first one we're going to go through is the nose, the pharynx, the larynx, the trachea, the bronchi, and then lastly the lungs. So it is important that you know the actual order that these are in. For some reason, every year some students get the pharynx and the larynx confused. Make sure you know that the pharynx does come first. So as we enter this diagram, you're going to go through the nostrils, then you go through the nasal cavity. Your pharynx is right here. Then we go down through your larynx. This is where your vocal cords are, or your voice box. Then we go into your trachea, and then from there, you go into your lungs, or more specifically, the alveoli. The oxygen will go there. There's a couple of major functions of the respiratory system. The first one is that the respiratory serves as gas exchange between the blood and the external environment. So the gas exchange actually occurs at the alveoli of the lungs. It is important to know that this gas exchange is a passive process. That means that it's going to occur by diffusion. And we'll talk a little bit more about that later. But these passageways also help to purify, humidify, and warm the incoming air. So make sure you know that in addition to just allowing, the respiratory system allows you to breathe, but it also purifies, humidifies, and warms the air. The nose is the first major organ that we're going to go through. So the nose is the only externally visible part of the respiratory system. Hopefully that makes sense. What I sometimes find is some students say, well, what if I breathe, or what if you have a person who breathes through their mouth? Does that mean that their nose or their nostrils and their nasal cavity are not part of the respiratory system? The answer is no. They're still part of the respiratory system. It's just maybe that person has a cold, or for whatever reason, they're not able to breathe through their mouth or their nose at that point. But the nose is the only externally visible area. Air enters the nose through the external nares, or the nostrils, and then the interior of the nose consists of a nasal cavity that's divided by a nasal septum. Some people have a surgery. They can have surgery on their nose. Maybe they have a deviated septum, so that doesn't allow air to pass through as it should. So if we look a little bit more specifically here, as we have our nostrils right here, then from there, you'll see that the nasal cavity is actually a little bit more complex than we're going to really talk about, but you have a inferior, a middle, and a superior part of your nasal cavity here. So basically this whole cavity is just a big space where air can go through, and as air passes through, then it's going to be funneled downward, which now will turn into a couple of other structures. So the anatomy of the nasal cavity, the olfactory receptors, olfactory has to do with smell. So the olfactory receptors are located on the mucosa on the superior surface. So that means that if we go back to this diagram right here, this top part right here is where you're going to have a lot of your senses of your smell, your olfactory receptors. The rest of the cavity will be lined with respiratory mucosa that help to moisten the air, and it helps to trap incoming foreign particles. Okay, so the lateral walls have projections that are called the conchae. These help to increase surface area. The reason we want to increase surface area is that it allows more things to be able to go through into your nose by increasing the surface area, allowing more things to be trapped. For example, if you're breathing in foreign particles when you're outside on a windy day, having more surface area allows more of those pathogens or those foreign particles to be trapped. The nasal cavity is also separated from the oral cavity by the palate. So you have two different kind of parts of your palate. You have the anterior, or the hard palate. Remember the palatine bone, okay, or that hard palate, and then you have the posterior, or the soft part of your palate, which is actually a muscle. Then we get into the paranasal sinuses. When we were going through the skeletal system, I guess the trimester before, we talked about how the sinuses help to lighten your skull. So the cavities within the bones surround the nasal cavity are your sinuses. They're located in the following bones. You have them in the frontal, the sphenoid, the ethmoid, and the maxillary bone. The function of the sinuses is to help lighten the skull. They also act as resonance and chambers for speech, and then they produce mucus that drains into the nasal cavity. So sometimes you can get a sinus infection where you have too much mucus there. Okay, so now we're getting into the pharynx. So we're done with the nostrils and the nose and the nasal cavity. Now we're into the pharynx, the next part. So this is just a muscular passage from the nasal cavity to the larynx. It's kind of the in-between. It is divided into 3 different sections. So you have the nasopharynx, which is first, the oropharynx, which is second, and then the laryngopharynx, which is actually the deepest layer of the pharynx. So the oropharynx and the laryngopharynx are the common passageways for food and air. So as you are swallowing, the pharynx actually has to filter through both food, drink, and air. Okay, so the structures of the pharynx. You actually have some tonsils in your pharynx, not really the ones that you probably usually are thinking of, but you have pharyngeal tonsils, which are your adenoids. They're located in the nasopharynx. The palatine tonsils are located in the oropharynx. So you can see that you have some tonsils up here. Those are your pharyngeal ones. Then you have some tonsils right here, which are actually 2 different types that they make up the oropharynx. And then you have the lingual tonsils, which are found at the base of the tongue. So a couple different types of tonsils that you maybe didn't know about before. Then we get into the larynx. So the larynx, the whole purpose of this is it helps to route air and food into the proper channels. It also plays a role in speech. They're made by 8 rigid hyaline cartilages and a spoon-shaped flap of elastic cartilage. This is called the epiglottis. The epiglottis is kind of a cool structure because it's a flap of skin that basically when you swallow, it covers your, so if you swallow, it's going to cover the larynx. So that way, when you're swallowing, food stuff doesn't go down your larynx and end up in your respiratory tract. So it's kind of a cool design. So that's what your epiglottis is. So you also have thyroid cartilage. This is the largest of the hyaline cartilage. It protrudes anteriorly, which actually forms the Adam's apple. And then a little bit more specifically about the epiglottis, it'll protect the superior opening of the larynx. It routes food to the esophagus towards the trachea. And then when you're swallowing, the epiglottis rises and forms a lid so to allow for food stuff not to go down through your respiratory tract. Okay, so a little bit more about the structures here. So you have your vocal cords, which are your true vocal cords. They're going to vibrate with expelled air that creates speech. And then your glottis are the openings that are between each of the vocal cords. All right, so now we're into the trachea here. So the trachea is also known as the windpipe. I find that I tend to call it the windpipe, but basically this is a 4-inch tube and it's going to connect the larynx with the bronchi. The walls are reinforced with a C-shaped hyaline cartilage, so that means it's going to kind of look like this. And having it reinforced is just going to add some extra protection for it. It's also lined with ciliated mucosa. It'll beat continuously in the opposite direction of incoming air. So the purpose of that is it's trying to purify, humidify, and get rid of the foreign material so it doesn't end up in your respiratory tract. If foreign objects get into your respiratory tract, that can cause an infection or pneumonia or I guess a viral or bacterial infection. They're also going to expel mucus that are loaded with dust and other debris. They try to take that debris away from your lungs because your lungs are a really delicate organ. So here's an example. So we have the ciliated mucosa that I was telling you about. The purpose of those are they are going to trap all of that foreign material. Then you have your hyaline cartilage that's in a ring. This is our C-shaped ring here. When I drew it the other way, so it doesn't really matter how you draw it as long as you know the difference between the anterior and the posterior there. When you see this says the lumen of the trachea, a lumen just means that it's a hole. or I guess not a hole, but it's a space. It's a hollow area. Then we have the main primary bronchi. This is formed by the division of the trachea. It'll enter, so I guess oxygen enters the lung at the hilum. This is a medial depression. And then the right bronchus is wider, shorter, and straighter than the left. And then the bronchi subdivide into smaller and smaller branches. So the bronchi divides kind of like the base of a tree, which I think I'll show you a picture right here. So yeah, we see a little bit of it here. So it starts out with we have the trachea here, then we're moving into the bronchi, and it's going to divide, and then eventually you'll see that it kind of branches out. Kind of reminds me of a tree trunk sort of thing. All right, so here's another view of it. This looks like a transverse section. So basically it's trying to show you that, hey, it really is sort of like a tree branch, and you have it interconnected with all of the different veins and the arteries where the alveoli are going to actually hook into. This is a part of the heart, so this is the pulmonary trunk. We haven't, I guess we've gone through that, so now you kind of see how the heart is interrelated to the lungs. It's all interconnected here through the veins and the arteries.